So two ways to capture any kind of seizure activity. Of course, if you have generalized epilepsy and always have generalized seizure, the best way to do this is in the hospital so you don't have a big seizure at home. It's just not responsible and there's too much injury potential. However, if all you're having are focal seizures, it's possible to capture these at home. So what would that entail? It's basically an ambulatory EEG, which is like a 48 to 72 hour EEG. They put it on your head, you go home with it. If you have any of your auras or anything, you activate the little push button and then your doctor reviews the whole EEG file. However, if that is normal, I think the next step would be to try to capture some of these focal seizures or even like interictal activity. So at that point, I'd say come into the hospital so we can take off your medication and we can capture this. The big issue here is medications versus no medications. A lot of people want to keep their medications on board when they're at home, and I think that's the most responsible way to do it. If you're going to have people taking off their medications or even reducing the dosage, you want them to be in a controlled hospital settings. So two ways to answer your question: ambulatory EEG, which is a take-home longer EEG, and video EEG, which is something that you do inpatient or in the hospital.